On this episode, we'll talk about training jiu-jitsu and boxing after weight loss surgery. We'll also talk about the importance of preparing your liver for a weight loss procedure, and we'll talk about the possibility of having weight loss surgery if you already have a colostomy. Hello everyone, I'm Dr. Alvarez with Endobariatric.com and welcome to episode 233 of the Ask Dr. A Show. Thanks so much for joining us. And if you are new to our show, I first of all want to welcome you. Thanks so much for joining us. And this show is about questions and answers. You're more than welcome to send me your questions. Just one big favor, use the hashtag Ask Dr. A. If you don't use the hashtag, believe me, there's no way for us to grab those questions. So use the hashtag throughout social media. We'll be able to grab those questions, add them here to the list, and I'll be more than happy to be here to answer them for you. Also, if I want to invite you to subscribe to our channel if you are new to us, if you like or you're researching weight loss surgery, gastric sleeve content, be sure to hit that subscribe button. That way you don't miss out of many of our future videos, because we throw out a lot of content out there. All right, so let's get into the show. All right, so the first question, it was a merging of two. I had a question on my list about training jiu-jitsu, and then down the list I had another question about training boxing. So we just did a hybrid here. We mixed both. So the question is, when can I train jiu-jitsu or boxing or anything that has impacts, all right, especially in the right here on the abdominal area. So first of all, I want to tell you that you can train after 30 days, a little bit more vigorous training, nothing directly here, all right, so no punching here on the incision sites. We recommend you wait at least 8 to 12 weeks. So be sure to touch base with your surgeon what type of training you want to do, but at least 8 weeks after surgery, no punching in the abdominal wall. Can you do it? Yes, I have professional boxers as patients. I have professional NFL players as patients, and believe me, they get hit hard. So can you train jiu-jitsu, boxing, American football, rugby, etc.? Yes, you can train that. You can do and practice those types of sports after a weight loss procedure, definitely. All we ask from you is you wait those 8 to 12 weeks for it to heal nicely, and then go ahead. Be sure to touch base with your surgeon so that you can get cleared for that. All right, so the second question is a very important question, very, very important question, is why is it important to prepare your liver for weight loss surgery? Or why should I do a pre-op diet for weight loss surgery? Or why is it so important to follow the guidelines on the pre-op phase to get me prepared for weight loss surgery? It all comes to the same thing. It is very important for you to understand that nowadays, 21st century, we perform pretty much all around the world, we perform laparoscopic surgery to craft these weight loss procedures. That means we do, it's also called keyhole surgery, which are just tiny, tiny incisions, and we poke with very small instruments, and we're able to perform those surgeries with very small incisions and long and very small instruments. So in other words, we don't open the patients up. I mean, there's no one big incision. So we place those little instruments, we place a little camera inside, and we don't have much space. So I tell patients, if you just came to me the first day, I'm barely getting to know you, you just touched base with my office, and if you want surgery like right away tomorrow, you did not prepare for surgery, I was so clumsy and say, yeah, come on in tomorrow, I'll do your surgery. I won't be able to. It's not possible because you have not prepared for surgery. That's why I tell my patients, you need to understand this, that you need to go through a pre-op diet that has an effect on your liver, that shrinks your liver. For me, at the time of surgery, to have that space. At the first meeting or the first time you contact my office, you have no space, all right? You have no space. There's no way for me to be able to go in and craft your surgery. So that is the importance. Follow your doctor's guidelines. The pre-op diet, the length of the pre-op diet, that in my office, it could be 3 days, it could be 5 days, it could be 7 days of diet preparation prior to surgery. It could be 10 days, it could be 15 days, it could be 21 days, it could be 4 weeks, it could be 5 weeks. All this will depend on your BMI, your body mass index, or how much you weigh before getting surgery. So if you're past 300 pounds, it's going to be 3 weeks of liquid diet. If you're past 400 pounds, it's going to be 4 weeks. If you're 500 pounds, it's going to be 5 weeks. If your BMI is between 32, 35, it'll probably be 3 to 5 days. A little up above 35, it'll probably be 7 days. So touch base with my office. We can let you know how long you have to do this pre-op diet. We supply that diet. We give you the guidelines on what you have to have, what the diet consists of, and to get you prepared specifically for that liver. Specifically, 80-90% of us that we have, or we eat an American diet, we have a fatty liver. And that is the main thing. With that fatty liver, I don't have space to craft your surgery to perform the gastric sleeve. I need to shrink the liver size to create this space. So when I go in with the little tiny cameras and instruments, I have that space. I'm able to reach out to your stomach, craft it the way it should be. And now that stomach, that sleeve will take off down the road and will help you for the rest of your life. So that is the importance. It's super important. All right. So touch base with your surgeon so you can have your guidelines, how long that diet is in your specific case, and then get your surgery and then have that benefit down the road. The last question is, I want to know if I can get weight loss surgery while having a colostomy. Colostomy is the colon or an opening of your intestine on your right here in your abdominal wall. All right. So for any known reason you had GI surgery, because of diverticulums, because of previous colon cancer, because of an ileostomy, because of many reasons you can get a colostomy or an ileostomy. So we have done it quite a few times. I want to say maybe in a year we get maybe 3 to 4 cases a year. It's the same procedure inside, all right? All we have to do is just take care of that colostomy, work around that colostomy. And yes, the answer is yes, you can. Be sure to touch base with your surgeon, with the office, so that way we know your complete history, why you had that colostomy, how they crafted that colostomy, and we can definitely work around it. Again, we get some cases a year with patients that have had previous colon cancer or definite a colostomy because of diverticulas or any other reason, and we're able to work around that colostomy and craft the sleeve. It's not an issue. All right, so there you have it. That is it for episode 233 of the Ask Dr. A Show. Again, send me your questions. Don't forget to use the hashtag Ask Dr. A throughout social media, and don't forget to hit that subscribe button. And one last big favor, go ahead and give me one of these. I really appreciate it. It helps a lot with our YouTube channel and the YouTube algorithm. I'm Dr. Alvarez with Endobariatric.com, where we are changing lives one sleeve at a time. Take care and God bless.